Well, thank you, Ranking Member Burr, and thank the chair for holding this hearing, and really thank you to all of our witnesses today for not only being here, but for your service. Before I get to a question, Dr. Walensky, I just want to second what Senator Murkowski said about getting the guidance to the fishing industry out as quickly as you can. I just met with my fishermen at the Yankee Fishermen's Co-op in New Hampshire this week, and we've got boats of fishermen who are fully vaccinated who see the Coast Guard coming, telling them they have to keep their masks on. Not only is a wet mask dangerous out on the open water, but because of the noise, both the wind and the equipment, these guys are used to relying on kind of sign language on the boat. And with a mask on, they really can't, and it's a real safety issue. So I hope you will take this under advisement and get the guidance out as quickly as you can. Dr. Fauci, I wanted to follow up a little bit. We've been talking about the very good news of the Pfizer authorization for 12 through 15-year-olds, and it looks like they may be seeking at least emergency authorization for 2 to 11-year-olds in September. And that's really welcome news, but many families are still looking for guidance about how to protect children under the age of 12 from the virus until a vaccine is authorized for them, especially as public health restrictions are being lifted around the country. And I'm hearing some from parents that the schools are mostly reopened or hybrid reopened, but they're kind of nervous about sending their children to school. So what advice do you have for families about what steps they can take to protect their children from the virus while we await FDA authorization for use of that vaccine for kids?
My recommendation, Senator, would be really to follow the CDC guidelines. I mean, both when the children are in the home with vaccinated individuals, the guidelines are clear what needs to be done. When they're outside, many things you can do without a mask outside, but if you're not vaccinated and you're interacting with people outside of the home from different locations, you want to be careful and have the children have masks. So I think a good following of the CDC guidelines, which, as Dr. Walensky says, continue to evolve in real time as they get more data, the guidelines get updated and upgraded. So that would be my recommendation. One other thing that I think is important is that there's a lot of work that we're doing now in clinical trials to get vaccinations for children younger than 12. So a bunch of companies, several of them, are doing what's called age de-escalation studies, where we're looking at children from 12 to 9, 9 to 6, 6 to 2, and then 6 months to 2 years. We think by the time we get to the end of this year that we will have enough information to vaccinate children of any age.
Well, that will be very welcome news to a lot of parents. Right. So thank you. Dr. Kessler, I want to follow up on a line of questioning that Senator Murphy was following. We've heard encouraging news, certainly, that the protection from the COVID-19 vaccines remains strong for at least 6 months and likely longer, but also that Americans will need booster shots, as you all may need booster shots, as you all just discussed. It's going to be really critical that these vaccines remain accessible and that their price reflects the large investments that American taxpayers made in the research and development of the technology. So what steps should Congress take to ensure that COVID-19 vaccines, including booster shots if needed, remain available to Americans even after the end of the public health emergency? And how can we ensure that pharmaceutical companies price these vaccines in a way that account for taxpayer investment?
Senator, a key question. Let me assure you that because of what this committee has done and your colleagues on appropriations, we do have the funds to purchase the next round, again, if they are necessary. So we will be able to purchase the next round and to assure that if there are boosters, they are free, just as the last round. I think you raise a very good question. Beyond that, beyond 2022, I mean, I look to your guidance and your colleagues on at what point do you transition back to a commercial market. But I think for this coming round, we are going to proceed as we have proceeded, and you've made those funds available.
Well, I look forward to continuing the discussion. I see that I am almost out of time here, but I did want to just ask Dr. Walensky quickly, can you speak to the importance of continued access to COVID-19 testing, even as we work to distribute the vaccine and people are getting, we're building up our community and herd immunity?
Yes, thank you very much for that question. First of all, we recognize that right now we've done an extraordinary job in getting vaccine to a third of Americans, and yet 2/3 of the Americans don't yet have vaccine. And in fact, our young children will not have access to vaccine for the rest of this year. We have put out $10 billion towards states to be able to do testing programs within schools. Some higher ed have been able to successfully engage in this past semester through testing programs on their college campuses. We're going to need to continue testing through our long-term care facilities, as well as our correctional facilities, our dense industries. And so, yes, I think there has to be a huge corner of what we are doing that is related to testing. Also surveillance, water testing, sewage testing to look for outbreaks. So we're doing a lot in the testing area. We're really grateful for the resources to be able to do so. Once we have vaccine in the majority of people, we are still going to have disease out there, and we're going to need to rapidly be able to detect it. Thank you.
Thank you very much. Thank you, Madam Chair.
Senator Marshall.